going to talk in next 15 minutes. I will not be taking more time. But one very important question, how many of us are actually taking the amount of protein which is required by us? I mean, hardly anyone. I can tell. I mean, Ashwin Dabi is saying that he is taking. I'm so happy that he is taking, but I am trying since long, and it's really extremely difficult, the amount of protein which I should take, and I am taking. Even it's not possible for most of our nutritionist colleagues also. Even they know that it is to be done, but it's really difficult. So optimizing muscle nutrition is real difficult, and I'll be talking along with prebiotics and probiotics. Protein intake in our country, I can say 73% Indian patients are protein deficient, but this may be true even all those doctors who know about it, still they are protein deficient. So maybe 75 or 80% of us. Today when I was talking, my close friend Sandeep Tak, he reduced significantly his weight loss, and we were talking about how much protein you are taking. And then we talked about body composition analysis. And I strongly promote body composition analysis for any metabolic clinic. Recently I know that you started a metabolic clinic. So metabolic clinic, the one important thing that each and every patient can go for BCA, but if you do your own BCA, and I think we should keep instead of doing a quiz for every one of us, that go and get your BCA. If you are at a fat percentage of less than 20%, which is recommended for an Indian male, or for a Caucasian it should be less than 15, then he should be awarded in a conference. Whether, I mean, that's what I wish that next year or in Diabetes India I will do it. The health issue associated with this less protein intake is the weakness and increased hunger, muscle atrophy, increased susceptibility to infection, brittle hair, nails, mood and cognitive impairments, and increased risk of stress fracture. And these are very common things and mostly ignored by physicians and clinicians. They will not able to understand that all these things could be because of protein deficiency. The recommendation is very clear. This is what 0.83 kg per day for healthy adults. It comes around 54 gram if a person of 65, but I am like 75, which is overweight or obese person. How much I should take for a vegetarian person is really very, very difficult. This is what a daily for older individuals. If I call myself older, I will not, if it's 54, but still maybe after 5 years or 10 years, this may be my requirement. I am extremely worried. Will I able to take it 1 to 1.5 gram per kg body weight with a 25 to 30 gram of protein in each meal? I mean in a breakfast, lunch and dinner. I am a pure vegetarian. I am talking about myself. I started taking egg since last 3 years. Every day in morning is a part of breakfast, going in a gym every day for half an hour to do a muscle strengthening exercise along with aerobic. I reduce my weight, but still to reduce my fat percentage and increase my muscle protein is very, very difficult. Even I am taking 2 egg every day since last 3 years. This is what happens. A life course changes in muscle mass and muscle strength. This you know that in early life and adult life it increases, but we start decreasing, and mostly this happens more with the Indian higher visceral fat, with less of aerobic activity, more of a sedentary lifestyle, and we have also some genetic factors may be responsible for this muscle mass to go down and muscle strength. This year, this conference which we are trying more with the history of diabetes, and 2 important points which tried in this particular conference, that increasing the awareness about the continuous glucose monitoring, the CGM, and that's what every quiz winner will get a 1 CGM, and all those faculty who are pre-diabetic, diabetic wanted to use CGM for them, we will definitely provide. And other is about the sarcopenia, muscle strength, the 5th vital sign for a metabolic clinic, like the way you are taking all other vital signs for each and every patient. So each delegate can have that gift of getting a muscle strength, for which he can hand grip strength machine, from which we can take from the Zydus stall right at the registration counter. And each and every faculty I have given this year as a gift, only to measure, because in our clinic we forget, we don't ask our patient to check the muscle strength. So we are dedicating this meeting more to understand more about the muscle mass and muscle strength, and that's the reason I am talking this particular talk. So prevalence of chronic health condition in Indian adults, it's irritable bowel syndrome maybe 4 to 7.5, prevalence of obesity and abdominal obesity is much higher, which is 13.85 to 57. So 5 out of 10 women between the age of 30 to 49 are abdominally obese. So I mean, I can say that all of us who are sitting, if I just get the visceral fat, if I just want to take the fat percentage, probably I can say 90% of us are obese or fat. I mean, that's sort of a condition in our country. But if I go with only BMI, maybe only 30, 40. But if I go with the central abdominal girth, then you will find more, and then accordingly with fat percentage, you will find more. The osteoporosis, osteopenia is very high. We know that hypertension, diabetes is extremely common. Why I had shown you the data of abdominally obese? Because this we don't discuss with our patient. And this is a real burning issue. When we discuss with the government of Gujarat, and now with the Honorable Prime Minister talked about the obesity prevalence, and suddenly Chief Minister one day said that on next day in newspaper came that we are making Gujarat free obesity. I mean, the Gujarat government had announced that, but it's really very difficult, extremely difficult for even the policy makers. Many things have to be done for next 25 years or 20 years to think about that can we decrease this prevalence of obesity. There are factors which are responsible for muscle health and role of nutrients. The function of muscle protein, its muscle contraction during exercise, which is very important to stimulate muscle growth by triggering repair and strengthening of muscle fibers. How many of us are really going for everyday regular muscle strengthening exercise? Some of us, we may say that we are going for a walk. Some of our patients, when we ask them, do you do exercise? They say, yes, I go regularly for walk, and they consider themselves that they are doing a good amount of exercise, but actually speaking, it's really very low. Amino acid intake from diet, which is essential for muscle repair, growth, highlighting the significance of dietary protein. Now, when we are giving this introduction part, the primary importance is that we need some sort of a protein supplement, or to explain the patient when we are talking in metabolic clinic. When a patient comes to you, you have to discuss the patient that what is your, protein intake, how much you do the exercise, how much time you go for exercise, what is your muscle strengthening, do you check your muscle strength also, your body composition analysis. All these are very important when we discuss. So there are lifestyle factors which are also responsible. Other than your sedentary lifestyle, the excess alcohol consumption, insufficient energy and protein intake, which is very common, excess calorie intake, which previous speaker talked about. If you are taking of more calorie, vitamin D insufficiency, cigarette smoking, inactive and sedentary lifestyle, and loss of skeletal muscle mass and strength and function, which we commonly see now, and we started talking since last few years. The protein, calcium, vitamin D on a musculoskeletal health. We understand the importance of vitamin D. We are now, I have not seen a patient who is having, or not a patient or anyone with a normal report of vitamin D unless he is replaced. Even myself, if I am not getting a regular vitamin D supplements, I have not seen a single person who is saying that his vitamin D is 60 and he is not on a vitamin D supplements. You will find that he is on vitamin D supplements, calcium and vitamin D both, along with the protein, which is very important. Some of our patients and some of the normal people, they start consuming the calcium on their own, and they feel that it is to be done or taken regularly, but without doing exercise. Just by taking the calcium or just some extra protein will help you, or will decrease your osteoporosis, or will be decrease your risk of getting fracture. That's not possible. The gut wellness and its role in nutrients, which is also very important. The importance of gut health in our individuals, that is effective digestion and absorption, improve gut motility, stable intestinal microbiota, effective immune status, and absence of GI illness. And I think we Indians, your Ayurveda, or you see your 1,000 years before the literature, you will find that Indian Ayurvedic system or that health system was related to gut. They always used to talk about the gut health, and that's very important. But over a period of time, our gut microbiota, our gut health, because of the food habits, everything is changed so much so that it has now created its importance, and now there is a separate branch. And before few years, I was in one of the meeting at Paris, and I found there is a dedicated meeting only on gut microbiota. There was an international meeting which was talking only on gut microbiota, and people from all over the world with a different specialty, they come and and we understood the importance of even fecal transplantation, which they are talking of it. So the role of gut microbiota in metabolism, in host protection and immune system development, and a gut muscle axis in all three is well established that it's very, very important. And gut microbiota is for synthesis of vitamins, amino acid, metabolize non-digestible carbohydrates and providing energy for the host. It is also for the host protection and immune system development and gut muscle axis. The prebiotics and probiotics impact on gut health. We all listen about the prebiotics and probiotics, how you explain your patient, what you give to them, what we should give. That's very important, and it's important science which we know. Prebiotic health outcomes, that it inhibits pathogens, modulation of probiotics, it reduces allergy risk, it enhances immune function, and it alters gut permeability. These are important functions of prebiotics, along with modulation of probiotics, production of metabolites, enhances calcium absorption, and decrease protein fermentation. So even if you are just taking the calcium tablet, probably it may not get absorbed. Maybe you are taking the protein, will not be. And these are the difference which we've seen also in our patients. Sometimes patients say that I do it all these things, but still it is not improving. The reason may be something else. So you have to do complete holistically for all these things. Effect of probiotics on a human health, immunomodulation, normalized gut microbiota, and metabolic defects. The prebiotics and probiotics in a protein absorption and muscle integrity regulate intestinal microbiota, induce host digestive protease, improve small peptides and amino acid absorption, and reduce harmful protein fermentation. This is a one complex slide just to understand that a gut and muscle axis is really very complex issue. We all must understand that gut microbiota and with muscle strengthening also there is a lot of correlation. So it's really very, very important for all clinicians. This is the highlights on a Bacillus coagulans unique IS2. It's a probiotic. It has got its own health outcome for adult gut health and muscle strength. There are research from data to show that this is what a no observed adverse effect level based on 14 days oral toxicity studies with 13 milligram per kg, which is exceeding the human consumption level. Properties of Bacillus coagulans unique IS2, which is on resilient nature, digestive enzyme, antimicrobial properties, vitamin synthesis, and probiotic potential. There are clinical evidence, these are the papers, to show that using this probiotic with whey protein, how it improves your muscle strength. It also had shown one other study to evaluate the efficacy in treating the functional constipation. Dietary fibers, which is again one more important part, like the calcium, like the protein, like the vitamin D, like the prebiotics and probiotics. This is what the dietary fibers. We always say that you should have more than 5 grams per day fiber or dietary fiber in your day-to-day consumption of the food, which is also decreasing over a period of time. There are highlights on a fructo oligosaccharides, which is a prebiotic. I am sorry that I am running fast because of time. The properties of FOS are it's water soluble, highly hygroscopic, and thermally stable. So it is resistant to hydrolysis by human digestive enzymes, and that's what higher viscosity than sucrose and high stable in the normal range of food pH. And this is what the mode of action to reduce colonic pH, inhibiting growth and proliferation of harmful bacteria which are harmful, and this probiotic will help your the other harmful bacteria will be going down and promoting the growth of certain good microbiomes. There are health effects for this. It is a prebiotic effect, relief from constipation, facilitates mineral absorption and modulation of immune system. There are clinical evidence of FOS on gut microbiota, effects of FOS on constipation, and the muscle loss begin, as we know, that as early in 30s. If we have a maintaining a healthy gut throughout the lifetime, this musculoskeletal integrity or the muscle mass, along with high protein supplementation with the vitamin D, calcium, and with fiber, probably can improve the muscle strength. And with these, which is very much required, first and foremost thing which I always say, that if we can do for ourselves, if you can do on your own, if you are going for a regular exercise, if you are taking care of your health by improving your metabolic health, probably you will able to convince your patient more effectively. Otherwise, hardly we will be talking about the muscle strength, hardly we will be talking about the prebiotics, probiotics, protein intake. the digestive system, all these things, and the fiber intake, which is really difficult. So in any metabolic clinic, all these things we should discuss with our patients. And with this, I'll be very happy if we can have any question or related to this. We have few experts who had come from, they can always comment on anything, whether it is prebiotics, probiotics, digestive enzymes, starch. So we can have, they can also answer if any questions is there. Thank you.